They may also have books out there which were written by Dr. Kelly. It's somewhat amateurish, but many people have used it and it also works. And that's called One Answer to Cancer, written by William Donald Kelly. So I think it's an easier way than to have you try to spell out the program, huh?
Thank you, Ruth. You bailed me out again.
Would you tell us something about the amount of supplements that you have to have in the Kelly program? Because I've been told that you're taking supplements all day long. That you'll be taking supplements all day long, and they're extremely expensive.
Well,
I wish people wouldn't listen to everything they're told all over the place. We get this. I've been told. You want to be told by an authority before you pay any attention to it.
Well, at any rate, having taken that metabolic test and finding out what my deficiencies were, okay, I had deficiencies. And these deficiencies had to be logically treated. And so he recommended certain vitamins and minerals. For the first 6 months, I maintained that schedule. And I did feel I benefited. But I didn't stay with it after the 6 months. After the 6 months, I felt that my system had gotten pretty much back to normal again. I was strong again. I could feel it. I felt no dependence at that point to go along with all those vitamins and minerals. I did stay with just a few of the basic ones, maybe E and maybe vitamin A and the beta-carotene. Whenever I wasn't taking my carrot juice, I'd resort to that as an alternative. But other than that, no, I didn't get carried away with vitamins and minerals, just stayed with the enzymes.
Mr. Carter, you mentioned some kind of mucus enzymes, but I didn't quite get the name. What were they called again?
Well, let Ruth explain that.
They're manufactured in Germany by a company called Wobimugos. It's not mucus. It's Wobimugos, M-U-G-O-S. But there are enzymes available here in the United States that will work just as well, except that they produced an enzyme that would dissolve so that it could be used rectally. If you want to use other pancreatic enzymes in the same fashion, it means really crushing them into a powder, but those dissolved very easily and were quite expensive.
Yes, that's right. It was expensive.
Question. One more question, please. Is the BCG vaccine, is that the same thing, or is that something different?
No, that's different entirely. They use that BCG vaccine primarily to treat tuberculosis. But since it did trigger the immune system, and there were reports that it may have helped the immune system in other forms of diseases, we felt it was worth the gamble to try it as long as it wasn't going to be harmful at all on the system.
I think that's the yardstick. Don't take a chance.
Mm-hmm.
Walter, I want to thank you first. And having a lot in common, it was great seeing you here after meeting you in 1950, to know that you're well and healthy. My question is something preventive for me. Having known me over these period of years, what would you recommend? I have nothing to concern myself about alternative, but maybe preventive. You were speaking to me about some exercise, some activity, like you were climbing mountains. We don't have mountains, we have the seashore. But what would you recommend for me? And I'll pass it on to some of our other friends.
Well, I guess you have to take the environment into consideration. And I feel that exercise is a definite part of this therapy. There's no getting around it. At least for me, being a physical person to begin with, it seemed like my body would respond best to that type or that degree of therapy. And so I guess you have to regulate that according to your circumstances and the environment. If you're not able to get out into an environment that's going to allow you to energetically make the body work, well then perhaps you have to resort to different types of equipment in the household. I don't know.
One last question about...
Well, I wanted to make a little point here. I think the books that you purchase are a very valuable investment. If you read a book for about $2.95 or $3, $4, you're getting the kind of information that that the doctor had compiled over many years of work, and you always have it available to you as a resource. Now, what I'd suggest for you is a book out there on the book table, which is called Food is Your Best Medicine by Henry Beeler. That's the place to start. Okay?
The last one, some don't recommend jogging. We're near the ocean. We can walk the boardwalk early in the morning. Would you recommend something like that?
Well, if you know how to swim, get in that water.
Okay. All right. Thanks a lot, Walt.
Good advice.
This may be hard for you to answer right now, but if you could turn time back, would you have gone through the operation, or do you think you could have cured yourself through the therapies that you chose?
All right, that's an excellent question. And I milled that question over in my mind since then. And I honestly believe that even though I may have been that far along in my cancer, that had I gone on this program with all the determination that I did eventually, that I think I could have, yes, turned it around, unquestionably.
Thank you very much.
I'd like to have more information on the on eyesight. The former cancer patient yesterday mentioned eyesight, and so did you today, but you did not elaborate when it occurred, before, after taking therapy, or under what conditions.
Well, I think Kelly mentioned in his book there, those are one of the first telltale signs that lets you know that something is happening internally. That's one of the smallest muscles in the body. And when cancer cells start to feed on protein, why, that's the first muscle in the body that's going to be affected and weakened. And my eyesight had always been fine up until then. And now all of a sudden, why, my eyesight was playing tricks with me. And I thought, it was just a simple case of getting old. But I realized later on it had to do with my cancer.
Could you elaborate? What do you mean by tricks?
Tricks. Well, the eyes don't focus. At times there you'd pick up something to read, and there the vision just can't focus on the material you're trying to read.
There's a weakness in the muscles.
Yeah, there's a weakness of the muscles. The muscles just don't function and focus on what you're trying to see with clear
Even with
visibility.
glasses?
Well, I wasn't wearing glasses at the time. You see, but again, having read the book, I was able to include that as a part of a symptom that could possibly be cancer. See, and that was a contributing factor.
A note was just given to me by the people at the book table, and they say they have sold all the copies of the Beeler book. But if anyone wants the copy, they have a book list out there. Just take the book list and you can order it by mail.
Could you describe or highlight the therapy that you undertook?
I would say that it wasn't all that sophisticated. It wasn't all that difficult. It wasn't terribly involved. In fact, I think what one should do when he gets on a program like this is simplify. Simplify it. Don't make it any harder than necessary for yourself. I think at first when one looks at a program of this type, he really gets rattled. It gets shaken up. Oh, my goodness, how am I ever going to keep pace taking all this not medication, but these enzymes, these vitamins, these minerals at all these given points in time. Oh, I bent and I twisted and I changed things around to suit my convenience is what I did. Because, you see, I had to go on functioning as a normal person would. This has to be the perspective that you maintain, and then you work this in with that type of a program.